Hi, I'm Dr. Julie Steinauer, and I absolutely love it when I get to brag on some of our patients. So this man who came into the clinic to see us quite a few months ago, he initially came in because he had had a stroke and he suffered some vision loss. He had been through OT and PT and gained back the use of a lot of things, faculties that he had lost as a result of a right-sided stroke. And so he was still struggling though with his left hand and kind of dragging his left leg, and he had some vision issues, including some vision loss. So let's look at his first visual field. This is a functional field, and this was his right eye. And then let me kind of show you what his left eye looked like. This was the left eye. Now, as I'm bragging, I'm going to kind of show you where he moved to. So this was from November when he originally started, and then this is from March, right before we had a shutdown in our office due to some of this crazy COVID-19. So you can see that this one is definitely larger for his right eye. Now let me kind of show you what happened with the left eye. Woo, look at that. This is the left eye before, and this is the left eye in March. Now, the real brag comes from showing you what the right eye looks like just this past week. So this is really amazing, and we're super excited to be able to say, this was the original, this is the new one. Let's look at the left eye, original and new one. Oh my goodness, what even more exciting than that, although he's super excited about the fact that he can see things all around him, is the fact that he's been able to go back to mowing his lawn, which is something that helps him to feel independent, like he's doing something for his house and being a part of the family. And then he's tinkering on cars again. He's able to do things more for himself. I'm kind of looking at a few things. The short-term memory is getting a lot better for him. He's also getting and gaining some more coordination in his left hand, so much that let's just show you one other test. Now this test is going to look like, what is that? But let me share with you why this is so amazing and why we are so proud of him. When he first came in, because of the difficulties that he'd had from his stroke, he couldn't hold a pencil in his hands and be able to do this particular test. They look at an instrument, they see this little box in the center, and it kind of superimposes on each side for them to trace. But here he was able to actually trace it with his hands, and he's gaining back some mobility here. That's really cool. The reason why that's starting to happen for him is that part of our program, besides vision therapy, where we're training the brain to kind of regain this vision, part of our program is actually Syntonic's phototherapy, where they're putting on goggles, which let me just see, I have a pair of goggles right here to show you. They kind of look like this, and there's a bunch of different colors. For instance, this one looks kind of yellowish, and these goggles, though, electrically retrain the brain on how to process vision and how to kind of turn things back on in the brain after someone's had a stroke. So at the same time that they're doing these, they actually sit there and kind of do this and squeeze a ball, like a squeezy stress ball, and it helps them to regain because it's sending a signal, like nerve conduction back into the hand and arm and into the leg that he kind of drags around. He can stomp his feet and stuff. And we're starting to see that he has the ability to be more mobile and the ability to use more of this hand again, which is awesome. It still isn't something that's perfect, but it's coming along so much better than when he initially started. The fact that he's getting to mow again and getting on the riding mower and doing that he's tinkering around with cars, that he's kind of doing some things self-sufficient for himself and taking care of himself, and that his coordination is improving dramatically is super exciting. Now, if you yourself have had a stroke or you know someone who's had a stroke, contact us to see how we might be able to help you. It's really best and it's ideal if we can work with you within a short time frame after you've had the stroke. But even if someone's had a stroke years before, contact us still, because there are still things that we can do to help you. And it's super exciting when we can help you regain a level of sight or vision that you've lost, help you maybe gain back some mobility, some ability to use your two eyes together, gain back some of your independence. So call us at 618-288-1489. You can go to our website website at visionforlifeworks.com. There's a questionnaire to fill out there if you don't happen to be local to us, because we have patients from all over the world. So if you happen to be in China or India, then we could still work with you. But you want to go to our website and fill out that information, and that's going to come over to us, and then we can connect with you on how we can help you. But if you're local, that'll only tell you just give us a call at 618-288-1489, and let's see how we might be able to help you regain some of that independence. Thank you.